Hello and welcome to the Community Partner 101 module. This is an introduction to the community partner role, the responsibilities, and resources that you all as community partners will have access to. We're going to go over three main things today in this little mini module. First, we're going to talk about what it means to be a community partner, your role, some definitions, and a little bit about the contracting and onboarding process. Then we're going to switch gears and talk very briefly about the Oregon Health Plan to introduce it with a mini deep dive into income when it comes to household income and how we measure that and what those income limits are. Then we're going to round out this module with a quick review of the resources you will have at your disposal as a certified community partner. So let's get started. First off, we're going to start with the basics. What is a community partner? Here are some definitions. You will hear us say OHP Certified Community Partner, or CP for short, both in reference to an organization that is contracted and certified by the Community Partner Outreach Program, as well as the individuals working within that organization. Another term we use for the individuals is application assisters. We go back and forth because we know that application assister is a name that hides many of the things that you all do that bring value to our program beyond assisting with a physical application. But just know that if we're saying CP, it might be an organization, it might be a person, and assister is always going to be a person. The Community Partner Outreach Program is a team within the Oregon Health Authority that supports community partner organizations and the application assisters who work for them as it relates to public medical program outreach, enrollment, and health system navigation. An application assister is an employee or volunteer who provides information about public and private health coverage options to potentially eligible consumers. Within your scope of work as an application assister, we expect you to be able to share information about health coverage options to Oregonians and also to help with health system education and navigation questions that people may have. When it comes to application assistance, volunteer organizations may choose to serve internal clients or also the public at large. For consumers who request assistance and for whom the organization decides not to assist, we ask that you provide a referral so that others may be able to help that person. And it could be because of language, because of capacity, or a whole host of other reasons. We just want you all to know that you can use the Find Local Help tool at oregonhealthcare.gov if you're ever not able to help someone and would like to point them in another direction. As a member of your community and a member of our community partner network, you are a trusted partner. We know that in addition to the application itself, assisters are looked to by clients for help with a host of health system navigation, education, referrals for services, and other things related to either the healthcare system or the social determinants of health. Here are a few key terms. When we say health system navigation, we're talking about assistance in removing obstacles or barriers that patients face in accessing or receiving quality health care. Health system education is information that helps a client understand the healthcare landscape, how to use benefits, and where to go for help in using those benefits. Social determinants of health are the conditions and the places where people live, learn, work, and play that may determine their health outcomes. As a community partner or application assister, you will be trained and certified by the Community Partner Outreach Program. While it may sometimes feel like it, this role does not include being an eligibility worker, a tax preparer, or legal expert. You should encourage applicants to provide accurate and truthful information so that you can then help them get their information to the state in order to assess and then provide potential health coverage options. You must provide unbiased health coverage choice counseling, which means that you cannot tell people what choices are best for them, but you may ask factual questions and help them find answers. You must provide information in an accessible, culturally and linguistically appropriate manner. And you cannot make eligibility decisions or assurances, so you should never tell someone before going through an application process that you know they will or will not be eligible. That's something that our system and our eligibility workers can make that determination, and as an application assister, we cannot. You must provide confidentiality, privacy, and security for any personally identifiable information that comes your way in this role. Consent forms are the first step in helping anyone who is new to your organization, and they really are the key to getting work done with the state when it comes to OHP. We ask that you store all documents securely for 6 years. Let's talk for a second about contracts. Your organization must comply with all applicable laws, which includes confidentiality of information, mandatory reporting of abuse, equal access to services, and non-discrimination. All services provided per your organization's contract must be available at no cost to the consumer. And when we're talking about services, we're talking about medical assistance and application services, not everything that your organization is doing. If you have any questions about what your contract with the Community Partner Outreach Program includes, please contact your organization's contract administrator for more details. Now that we've talked a little bit about what a community partner is and some of the nitty-gritty with contracts, here's some guidance on how to become an application assister. We have a document called the CP Requirements Guide that outlines the steps to getting fully onboarded, both as an organization or as an individual within an organization. When it comes to the organization, we have 2 potential contracts that your contract administrator will have to sign and send back to OHA. We have a provider addendum, which is used for any organizations that currently bill Medicaid in the state of Oregon. If you and your organization do not bill Medicaid, then the volunteer application is the document for you, and that is available as well. As a note, this is the point where you will want to identify who the primary contact in your organization is. This person can help walk you through the onboarding process and is a key contact in interacting with our business team. Once we have an organizational contract in place, we can look at individual account creation documents, which collect the info we need to get you as an individual up and running as a community partner. If you ever have any questions, our business team is here to help. You can reach them at cp.business@dhsoha.state.or.us. Let's talk briefly about the health coverage landscape in Oregon. The Affordable Care Act did a couple things specific to how people are able to access health coverage options. And I'm just going to go over 2 of those many things. So first, we have Medicaid expansion, which means that in Oregon now, many more people qualify for the Oregon Health Plan, which is Oregon's version of Medicaid, and that we are able to offer it to many more people. We also have the health insurance marketplace, which is an option for people who are over income for OHP or perhaps for another reason do not qualify and don't have an affordable employer-sponsored coverage option. So these qualified health plans may be subsidized, and there is an application process that you as a community partner may train in order to help people with directly. We're going to talk about the Oregon Health Plan today and in the training you're going to take shortly with your regional outreach coordinator. But just know that our friends at the Oregon Health Insurance Marketplace also have a lot of resources and trainings for you on the marketplace side of this. When it comes to the Oregon Health Plan, there are a few different programs built within what we call MAGI Medicaid. So MAGI is Modified Adjusted Gross Income, and you do not have to memorize that acronym just to know that this is one type of Oregon health plan, but this is the type of Oregon health plan that most people you work with will qualify through. There's OHP Plus CHIP for children age 0 through 19. That goes up to 305% of the federal poverty level. And for adults, age 19 through 64 goes up to 138% of the federal poverty level. And I know I just mentioned federal poverty level, which is this acronym here, FPL. We will show you on the next slide what that means in actual numbers. Just know that it changes slightly every year. And so we're using the percentages here so that this document continues to be useful for you. We also have OHP Plus for a pregnant adult, which has its own income level too, 190%. Now, mirroring the OHP Plus, which is a full benefit package, we also have something called Citizen Alien Waived Emergent Medical, or CAWM, which is for non-pregnant adults who do not have lawful permanent residency for at least 5 years or lack legal status altogether. This is just like OHP Plus for adults at 138% of the federal poverty level, but includes only emergency care, not a full benefit package. We also have CAWM Plus, which mirrors OHP Plus for pregnant adults because it is for pregnant adults without a legal status or who have lawful permanent residency, but it is less than 5 years. And that actually is a full benefit package. So CAWM Plus and OHP Plus pregnant adult are very similar, nearly identical benefit packages, but CAWM itself, if someone is not pregnant or not in the 2 months after the end of a pregnancy, would be emergency only care. We also have a program called the Parent Caretaker Relative Program, which is our only MAGI program that has no age restriction. The most common example is if grandparents are taking care of grandchildren, they can be dually eligible for Medicaid and Medicare. This is administered through OHP and it has a very low income level at 42% of the federal poverty level. Now I know I just said a lot and this is not something that you need to memorize right off the bat. We just want to point you in the right direction for when you are helping people. And I also want to say right off the bat that you do not need to screen people out of applying by using a chart like this to see who is eligible. This is just to help you understand when you do get determinations back, why people might have gotten approved or denied when it comes to income. So this is not a screening tool. This is for your information so that you can figure out if something might have gone wrong in a case or if you should have anything that is varying from expected results. So on this chart, we see for 2020, there are all those programs we were just talking about. There is Parent and Other Caretaker Relative Program, and it's first because it has the lowest income eligibility, which is 42% of the federal poverty level, which for a household of 1 is $399, and for a household of 2 is $515. What you see from here is that we need to take the whole household size into account when we're looking at someone's income eligibility individually. And we will talk more about what makes a household in the training that's coming up next. So this is just your primer to get your brain going in the direction of MAGI Medical and OHP. The next column you see is up to 138% of the federal poverty level, and that includes adults and then children who have other major medical. It is a common misconception that if you have coverage, you cannot qualify for Medicaid. That is not necessarily true. Children who have other major medical qualify at the same level as adults because technically there are two different funding buckets that children may qualify through. One is Medicaid and the other one is the Children's Health Insurance Program, or CHIP. And we'll circle back to CHIP in 1 second. So adults, a single adult qualifies at a monthly income, and this is gross income, of $1,468 per month or less. A household of two, so let's say a married couple living together, married filing jointly, no children, they can make a collective $1,983 per month and both qualify potentially for OHP. You'll see that it goes up by the exact same number each time you add a new member of your family or household. We talked about the pregnant adult program, which is this next column at 190% of the federal poverty level. And I do want to let you know that when we are counting household sizes for a pregnant person, we count any unborn children in that household size. So you should very rarely, if ever, see a family size of 1 for a pregnant person. So a pregnant adult who is expecting 1 child could make up to $2,730 each month and still be OHP eligible. Children are also wrapped into this pregnant adult program for the first year of their life. But a child may also qualify. It's kind of funny. A child can qualify at 138% of the federal poverty level if they're 1 to 18. They can qualify at 190% of the federal poverty if they're 0 to 1. And those two categories are if they have other major medical. If they have no other major medical, then they'd qualify at this next column, which is the Magi Children's Health Insurance Program, or CHIP level. And that's up to 305% of the federal poverty level. For example, a household of 4, 2 parents and 2 children, can make up to $6,660 per month, and the children may qualify for OHP. So you can see that depending on your demographics, you may end up in different categories with different income eligibility levels. We also have an annual income level here, which is that final orange column, and we'll talk more about that in your upcoming training. Now that we've gone over a whole bunch of numbers and a whole bunch of columns, let's try to make it a little bit real with some scenarios. So here is our practice person number 1. My name is Oliver. I'm a 40-year-old single male with no kids or dependents. I'm a U.S. citizen, and my monthly income is consistently $1,300 a month. What might I be eligible for? Now, if Oliver is a resident of Oregon, then he would potentially qualify under the adult program, which is at 138% of the federal poverty level. He has no tax dependents, he is not married, and he has no kids. So it looks like he'd be a household of 1. $1,300 is less than the maximum of $1,468, so he is likely eligible for OHP. This next example is Mary, a single pregnant woman with no children or dependents. She is not a U.S. citizen, and her income is $2,300 a month. So since Mary is pregnant, we know that we would be looking at the 190% of the federal poverty level. And we don't know, but we're going to assume, unless we hear otherwise, that she is pregnant with 1 child, which means that her household size would be 2. And she can make up to $2,730 per month and still be potentially OHP eligible. Now, another piece at play here is that she is not a U.S. citizen, which means that depending on her immigration status, she might qualify for OHP plus pregnant adult, or she might qualify for OHP COWM plus, which mirrors OHP plus benefits, but is for people without an eligible immigration status. We don't have enough information in this example to definitively say so, but most people, when they present to you to get help with navigating OHP, will not have all the answers right off the bat. So this is when we should fill out the application together and help them navigate that process. One final scenario. Cameron and Bailey are a married couple with 10-year-old twins. Their combined monthly income is $4,500 a month. Now, this is a family size of 4. I'm going to make the jump and say they are U.S. citizens, just so we can get to an answer here. And let's look and see what they might be eligible for. So now if we are looking, let's look first for Cameron. Cameron is an adult in a household of 4. The maximum monthly income for an adult in a household of 4, looking at this chart, is $3,013. So Cameron and Bailey, as adults, are over income for OHP and might benefit from talking to someone about a qualified health plan at the marketplace. Looking at the children's income level that they can qualify at, though, that is $6,660. So this is a situation where we have something called a split household. The adults are not OHP eligible, but it looks like the children likely are. Now, let's say that one of these adults is pregnant, and therefore we're looking at a household of 5. So that changes the calculus again. A household of 5 and an income of $4,500 a month. Looking at the Magi Pregnant Person Program, household of 5, you can make up to $4,858 and still be eligible. So in that scenario, the pregnant adult would be OHP eligible, the twins would be OHP eligible, and there would be, let's see, looking at the non-pregnant adult, even for a household of 5, that number is still below 4,500, so we would still have one adult who is not OHP eligible on this case. Now that we've talked about a brief introduction to income, and just know that you will have plenty of opportunities to see what that looks like out there in the real world, we wanted to talk about resources that you have access to specifically because you're part of the Community Partner Network. So first off, we have a community partner only phone line. They will only interact with people with assister IDs that are current. So this is a direct line to eligibility workers at the OHP Processing Center who can help you resolve tricky cases, get status updates, and otherwise help work through situations that you are unable to resolve in other ways. In addition to the phone line, we also have CP-only email inboxes where you can securely email specific case information in order to help resolve tricky situations, get status updates, the same sort of things you could do over the phone line. If it is not urgent and it could take a day or two, the inbox is a great way to do it instead. We also have a whole host of guides, marketing materials, an online community that the Community Partner Outreach Program maintains, which includes a library of training videos, much like this one, something we call Group Site, which is, I like to call it sort of like Facebook for work, therefore it's less fun, but it's super informative. So it has a discussion board, it has a whole host of paper documents like one-pagers, it has official forms, it also has all of the rest of the Community Partner Network who are often asking questions, answering questions, and it's a great place to learn and to get support. And it's always being watched by at least one person on the Community Partner Outreach Program. Speaking of which, you have our whole team. So we have trainers, we have our business team, we have contracts help, we have regional outreach coordinators who, depending on which county you're in, you will have a different person who is at your beck and call to help you with coaching, support, any technical assistance, sometimes just someone to call and vent on the phone. We are here for you, and we take supporting you very seriously because your success is our success, and we want to make this go as smoothly as possible for you. We also convene formal work groups and other opportunities to address big picture system issues. If there's an issue with how our processes are going at the state, if you think there might be opportunities for us to further equity across the state or in your community. These are the things that we want to help work on in addition to those case-by-case examples. We also have a state secure email server. We have regional collaborative meetings that we convene once a month, and a whole host of other things that we offer as well. Because secure email is so important, and you might be sending things like your personal information to the business team pretty soon, we wanted to show you right off the bat how to access the state secure email, which is this URL right here. We ask that if there's ever personally identifiable information about any case, or frankly about you, that you need to send us for either contract purposes or for working on cases and helping to resolve something, that it goes securely to the state using our secure server. Security only applies to the contents of the email, not to the subject line, so please don't include anyone's name, anyone's prime number, anyone's social security number in the subject line of emails. And just know that this is a tool where you can contact anyone whose email ends in @dhsoha.state.or.us. So that's it for our introduction to what a community partner is, a little bit of eligibility information, and a quick list of your resources. How do you get started? Your next step is to take our One Integrated Eligibility New Assister training. If you're not sure where to get to training dates, you should be able to reach out to our business team at cp.business@dhsoha.state.or.us. The fact that you're at this probably means you've already been in contact with someone on our Community Partner Outreach Program team. So hopefully that person sent you the information you need, but if not, just know you always have more people to reach out to. The training that's coming up next is more or less an all-day training. It goes from 9 to 3 p.m. and it covers medical programs offered by the state of Oregon. So a big focus on the Oregon Health Plan with a few other additions as well. Once you've registered for the training, you will receive all of the materials you'll need via email, and know that it is up to you whether you print them out or maintain them as an electronic resource. And if you know who your regional outreach coordinator is, feel free to reach out to us as well. Your supervisor might also be able to connect you with the appropriate person. We are here to help with any questions, any orientation, anything at all that we can do to help you get into the network and successful within it. We're here, and that is our goal. Once you've completed the training, congratulations, you'll be an active assister. You do have one last step, which is to complete a marketplace training. I mentioned that there is the OHP side of things and also the marketplace side of things. We want to make sure that everyone has the tools to help people find the right solution for them, whether they are OHP eligible or not. So there are a few training options on the marketplace side that our friends over at the Oregon Health Insurance Marketplace will give you more information about. We wanted to end this quick mini presentation with a big thank you for your interest in becoming a part of our Community Partner Network and a part of our team. We have upwards of 1,300 people doing this work across the state, and we have a pretty small group of about 15 people that help you get there. And we take our team very seriously. We work very hard to maintain as much of that team feeling as possible, and we hope that you are successful and that you feel like you have a great starting foundation to build upon for your experience to come. Thank you so much.